For the prevention, you can get the hepatitis B vaccine if you haven't already been infected. It's key to prevention. Now for its schedule. For adults between 19 and 59 years old, the CDC recommends a 2, 3, or 4 dose series depending on the vaccine. For instance, for Hepatitis B, you should get 2 doses 4 weeks apart. For Engerix B, Pre-Hev-Brio, or Recombivax HB, you should get 3 doses 4 weeks apart. For Twinrix, used for both HIV and HBV, you should get either 3 doses with the first and second 4 weeks apart, and the third 5 months after the second, or 4 doses with the first 3 doses 7 days apart, and a fourth booster dose at 12 months after the first. For children and teens 19 years old or younger, the CDC recommends 3 vaccine doses with the second 1-2 months after the first dose and the third and last 6 months after the second, regardless of the vaccine. The CDC recommends all infants get the first hepatitis B vaccine dose within 24 hours of birth, followed by a second dose at 1 to 2 months old, and the third and final dose when they are 6 to 18 months old. Infants born to people who are positive on hepatitis B surface antigen test should get the first shot of the hepatitis B vaccine and HBIG within 12 hours after they are born, followed by a second dose at 1 to 2 months old and the third and final dose when they are 6 to 18 months old. If you miss a dose of the vaccine, you don't have to start the series over again, but you should get the next dose as soon as possible. How long does the hepatitis B vaccine last? The vaccine generally protects you against HBV infection for at least 20 years and probably for life. For other prevention, you should avoid sharing personal items such as razors or toothbrushes. Do not share drug needles or other drug equipment, such as straws for snorting drugs. Clean blood spills with a solution containing 1 part household bleach to 9 parts water. Be careful when getting tattoos and body piercings. Practice safe sex. Good hand washing by all family members must be done. Hands should be washed using soap and warm water before meals, after using the bathroom, and before preparing or serving food. Thus, we should have good hand hygiene. Washing your hands after caring for your child, as you may have come in contact with the hepatitis B virus from such things as changing diapers, cleaning up vomit, or exposure to blood. Wear disposable gloves when handling blood, like helping to stop a nosebleed or bandaging a cut. Wash your hands after removing the gloves. Now for the infection control precaution. Isolation is not required, contrary to hand washing. Gloves and apron are required when blood or body fluid contact is possible. Masks and eye protection are required when splashing of body fluids is possible. How to disinfect blood or body fluid spillage. We use chlorine releasing agents at a concentration of 10,000 parts per million ppm available. Chlorine should be used to disinfect blood or body fluid spillage. How to manage waste. Treat waste as clinical waste and dispose of via clinical waste stream. Orange waste sack. For the linen and laundry items contaminated with blood or body fluids, they should be treated as infectious linen and bagged accordingly. Nursing considerations are divided into two parts. 1. Behavioral intervention. Regular review time and items should be based on specific conditions, but generally should be reviewed every 3 to 6 months. The review items mainly include liver function, hepatitis B, liver B ultrasound, hepatitis B virus DNA, etc. Timely understanding of the liver damage and the extent of the disease, and timely targeted hepatitis B treatment and that are timely and effectively ensure the stability of the hepatitis B disease, preventing further deterioration of hepatitis B disease. Now for the diet, it should be balanced. Patients with hepatitis B should ensure a balanced diet. Protein, carbohydrates, fats, vitamins, minerals, etc. in food should be kept in proportion. In addition, do not overeat or starve, because this hunger is an unbalanced eating habit that can lead to abnormalities in the digestive juice, which can easily lead to liver disease. That is not good for our condition. A diet should be light. Since the liver is the largest metabolic organ in the human body, we need to help us deal with a lot of trace elements every day. In order to reduce the burden on the liver, we should adopt a palatable and light diet. If the appetite is good, we do not need to strictly control the diet. We can eat some foods with high nutritional value to ensure normal nutritional needs. If the patient has nausea and vomiting frequently, the diet should be appropriately restricted in the short term to reduce the burden on the gastrointestinal tract. Appropriate supplementation of glucose, electrolytes, and vitamins while limiting your diet are advised. There must be a certain amount of vegetables, all kinds of food, fruits, and appropriate amount of protein in the diet. After the appetite returns to normal, the amount of rice should be properly controlled. Generally, it is advisable to have hunger before the next meal. Less greasy food, fried food, and other foods do not need to be too restrictive. Patients with stable hepatitis B are based on a balanced diet, basically the same as normal people, adding vegetables and fruits to supplement vitamins. For the protein supplementation, because hepatitis B is a more difficult disease to cure, we mainly resist hepatitis B virus by improving immunity. For patients, a good way to improve immunity is to add protein. If you don't want to eat nutrients, then it is recommended that you eat high protein foods such as milk, beans, and soy products, fish, eggs, and lean meat in your daily life. The protein ratio is 1 gram per 1 kilogram of body weight per day, of which the fish has the best quality protein. When edema or ascites occurs in chronic hepatitis, the principle of low salt diet, less than 3 grams per day, water 1000 milliliter to 1500 milliliter per day, combination of work and rest. Patients with hepatitis B should pay more attention to rest and have enough sleep to ensure sleep 7 to 8 hours per night. When you have enough sleep, your immunity will improve, regulate the physiological functions of various organs of the body. Your disease resistance will be strong and play an important role in the recovery of the liver disease. In addition, hepatitis patients should be absolutely bed rest. The general patient can improve with the condition slowly by increasing the amount of activity, get up before meals, appropriate activities such as indoor and outdoor walking is conducive to increased appetite, but must rest after lunch. This will allow more blood to flow into the liver, ensuring that the liver has sufficient oxygen and nutrients, which is conducive to the regeneration of liver cells and the recovery of the body. 2. For the drug intervention. Correctly counseling patients to take drugs. The liver is the organ that metabolizes most drugs, and the drug metabolism process often produces some toxic substances which easily damage the liver and cause drug-induced hepatitis, which is more likely to aggravate the liver condition. So the nurse needs to be strict before taking any drugs. Do as prescribed by your doctor to avoid affecting your health. Pay attention to the adverse reactions of drugs. Regular monitoring and follow-up and timely adjusted drugs. Antiviral treatment requires patients to actively cooperate with doctors, monitoring HBV DNA level, liver function, and so on every 3 months.